Some women are just having a really hard time with it, and some it's not affecting them as much.
That was Brittany Garza, a COVID-19 patient who recently gave birth, talking to ABC4's Nick McGurk earlier today about her emotional experience with having COVID late into her pregnancy. Welcome to our In Focus discussion tonight, COVID-19 and pregnancy. The pandemic didn't stop the world from spinning. Families still having babies, even as the case counts and transmission rates have not slowed down. Pregnancy can be a very difficult time with lots of health concerns for the mother and her baby. So what happens when an expected mother gets COVID-19? Joining us now is Brittany Garza, the woman you just heard from at the top of the segment. Brittany, thank you so much for joining us tonight along with baby Emery and sharing her story.
Thank you.
Now tell us about your baby daughter, Emery. When was she born? How are you and her doing now?
So this is Emery. She is 6 days old. She was born November 27th, and she's super healthy. I mean, besides keeping us up at night, which is normal, she doesn't have any problems, and I'm doing great, recovering great. Don't have any problems now.
That's so good to hear. Now, when did you find out that you contracted COVID-19, and how did that make you feel when you found out about the news?
So I was 36 weeks pregnant. My son and husband had tested positive. We were quarantining from each other. But I still ended up testing positive 5 days later. And I was just super nervous about what it meant for me, what it meant for my baby. There's not a lot of information when I would look on the internet about it. There were different things that I read, like if you were in labor and you had your baby when you were COVID positive, your baby could be taken away, which was like a big fear for me. And then just unsure of what that really meant for us.
Wow, so it's almost like you found out that you were pregnant with her at the beginning of this pandemic, and then as the pregnancy evolved and towards the end, when you were close to your due date, that's when you found out you had COVID. So it's kind of like you've been through this from the beginning to the end. So let's talk about what your doctor prescribed for you once you tested positive. What did you have to do, and did you really have to give yourself injections?
So I was a big wuss. I couldn't do it. I tried and I couldn't do it. So my sweet husband gave me injections twice a day for 2 weeks, right after I found out. And I was 36 weeks. So typically at that time, you're starting to go to the doctor every week, but I couldn't go to the doctors again until 38 weeks. And then we did a non-stress test on the baby to make sure everything was okay with her. And I was induced a week early. And now I am doing blood thinner shots again once a week or once a day for 2 weeks.
So you found out you were pregnant in March when the pandemic started. Were you thinking about the disease throughout your pregnancy before it actually happened? And did you take any extra precautions, or did you approach your pregnancy differently?
Yeah, it did. It changed a lot of things about my pregnancy. My husband wasn't able to go to any of my appointments, which was always changing. The rules around that were always changing throughout my pregnancy. He even tried to come to the first one, but he was turned away. And I was super nervous if he was going to be able to come to the birth, because that would be terrible. I even contemplated possibly doing a home birth because I really wanted him to be there. But I definitely took some extra precautions. We both worked from home as much as we could. We wore masks. We washed hands, hand sanitizer, everything to try to take all the precautions we needed to not get COVID-19.
Now that your baby's here, do you have any concerns now?
I'm concerned about my baby getting it. I'd say we tried to find the positive in this. Everybody in my house got it. And one positive thing we found, we were like, well, at least we have antibodies for 3 months, or I guess that's what the studies are showing right now. So the one positive is we won't pass it to the baby, but our family won't. But outside people we're still being really cautious about.
Now, we've heard about the kind of symptoms that someone could get if they contract COVID-19. After you tested positive for the virus, did you experience any symptoms that were different from what you were already experiencing during your pregnancy?
I think that was a tricky thing, was trying to decipher, is this because I'm so far into my pregnancy, or is this a COVID-related symptom? So you already have extra blood flow, so I already was really like having a hard time breathing, but I was super congested. just really fatigued. And you're already fatigued when you're super pregnant. But once I got past the COVID, I could look back and say that was extra. I was extra fatigued. And then also a little bit lightheaded, which I wasn't sure if that was from the blood thinner shots or from the COVID. So it was kind of hard to tell what was happening from what, blood thinners, pregnancy, COVID.
What a journey you have been on. Okay, so some final thoughts. What would you say to other women who are pregnant now and either have COVID-19 or fear getting COVID-19?
So I think it's a healthy fear to have, and taking the extra precautions necessary are worth it because there isn't a lot of information. I mean, my doctors were super helpful in guiding me, but I think they're still learning a lot about it. So there's still uncertainty, like how could it affect the baby long term. I think there just isn't that type of information. But if you have it, I mean, my doctors were super helpful in telling me this is what we have, this is what we know now, these are the precautions you should take, and just talking me through all that. So if you have it, I think relying on your medical professionals is a great way to go.
All right, you've been hearing from Brittany Garza, who had COVID-19 and recently gave birth to baby girl Emery, who you see there. Brittany, we appreciate you so much for being here tonight. Thank you.
Thank you.
Although the virus doesn't cross the placenta and get to the baby, it can get to the interface between the placenta and the lining of the uterus, where it can cause some changes in the blood vessels that changes how much oxygen and food and fluid are getting to the baby across the placenta.
That was Dr. Esplin in an interview with ABC4's Nick McGurk earlier today about how the virus works with pregnant women. So far, it seems the baby is safe from the virus while in the womb. Thanks for staying with us for our second In Focus discussion on COVID-19 and pregnancy. Joining us now via Zoom is Dr. Esplin, the Medical Director for Obstetrics at Intermountain Healthcare. Hi, Dr. Esplin. Thanks for spending your Thursday evening with us.
Hi, thanks for having me.
Now, doctor, when did you start thinking about how pregnancy would be affected by COVID-19?
You know, as soon as we heard about the first cases, it was something that we were interested in. Viral infections during pregnancy can cause different problems. Some of them are not a problem at all. Others actually can cross the placenta and cause problems for the baby. So we had our first positive pregnant patient test in March 19th of this year. And since that time, we've been gathering information and trying to learn from every patient so that we're making sure that we're providing the best care possible.
Now, I know people are affected differently by the disease. Do you have any concerns or things that you worry about, even with mild cases?
Most people will have mild symptoms, and most people do very well. So I think people, if you have it and you have mild symptoms, you should be just fine at home. Sometimes, even though you don't have severe symptoms, your oxygen levels in your blood may be a little low. So if you're feeling dizzy or lightheaded or you have increased shortness of breath, it's probably worth talking to your doctor or healthcare provider just to make sure that you don't need to be tested.
Talk about the extreme cases when blood clots affect the placenta. What have you seen here in Utah?
So we at the beginning of the pandemic, we did see a higher number than normal of stillbirths that happened in some women who had were positive for COVID and had severe symptoms. So that made us concerned, and so we've been taking extra precautions. The good news is we haven't seen that increase continue. We are looking at the placentas and finding some changes that are associated in some cases. So we continue to be very careful, and just as Brittany mentioned before, we will sometimes do a non-stress test where we can check to make sure the baby's getting plenty of oxygen, and we may do an extra ultrasound to look at the growth in the fluid just to be sure that things are okay.
What have you been hearing about nationwide? How many expecting mothers are being affected by COVID?
You know, the numbers of pregnant women seem to mirror the numbers of people in the community that are being positive. So we haven't seen an increased rate compared to the general population among pregnant women. Here in Utah, as you start to see the surges after Halloween, and now again as we start to come out of Thanksgiving, we're seeing a similar increase in the rate of infection among pregnant women. So we now have over 800 women who are pregnant and have had COVID in the Intermountain system, that about half of which have delivered and half who are pregnant and continue their pregnancy. So we're seeing about the same rate as the general population.
Can you talk generally about an expecting mother's immune system? Because she is pregnant, is she more likely or less likely to get sick? And does that translate into whether she is more or less likely to get COVID-19?
That's a great question. It turns out that the immune system is altered slightly during pregnancy to allow the mother to carry the pregnancy without a problem. Those changes with some viruses can cause an exaggerated effect in the mother that can cause a problem. That's not something that we've seen necessarily with COVID-19. We have had women who have been very sick, but the number of women who get very sick tends to be about the same as the general population, and the number of people who get very sick when they're not pregnant. So with this particular virus, we haven't seen a significant change due to pregnancy.
Let's talk about the process of giving birth. I mean, before COVID, you could have your family members in there, right, in the waiting room, but that's all changed now with COVID. How does that process look now, pre and post-COVID?
Well, as I was listening to Brittany talk, I can understand how when this started for her, she was really nervous because we didn't know exactly what to expect. We didn't know whether, babies would be affected and whether it would be safe to have people in the room at the time that someone's delivering who might have COVID. We've really learned a lot over the course of the pandemic that allows us to actually have the interventions and the changes that happen at the time of your delivery to be really minimal. We do limit the number of people that are there, but we recognize how important it is to have your closest family members there with you and to have support during labor. So at this point, we're not keeping people out. We're letting partners be in the room. And even if patients are positive, we're learning that keeping the baby with the mom and actually helping the mother to understand how not to pass the infection to their baby is actually really important. We recognize how important it is for moms to bond and to start the breastfeeding process. That can be done safely if you have COVID, but it does require some education and some practice.
Now, is there a difference, or are you seeing any different patterns if an expecting mother catches COVID in the beginning, the middle, or maybe at the end of her pregnancy, like we saw with Brittany?
That's a great question. It turns out that it's really common in other viral infections to have people, it really depends, what outcome depends on when in the pregnancy you're infected. We're collecting data right now on people who, and the number of people that have been infected are really spread out across the pregnancy. We have hundreds in the first trimester, the second trimester, and the third trimester. We haven't really noticed a pattern depending on the time of your infection, the timing of your infection, but that's something that we plan to look at more closely going forward.
All right, hold that thought, Dr. Esplin. We have to take a quick commercial break, but when we come back, we resume our In Focus conversation on COVID-19 and pregnancies. Welcome back to our third and final In Focus discussion tonight on COVID-19 and pregnancy. We're looking into how at-risk expecting mothers are during the pandemic. Before the break, Dr. Sean Esplin, Medical Director for Obstetrics at Intermountain Healthcare. We pick up right where we left off. Dr. Esplin, if a woman is pregnant, what do you recommend for testing for COVID-19, and how often or how early?
That's a great question. So right now, we're not recommending routine testing, but if you are having symptoms that are concerning, you should call your doctor or your midwife and ask whether testing is appropriate. So that's a fever, symptoms of shortness of breath, cough, sore throat, those types of things, especially loss of smell and taste. If you have symptoms that are concerning, call your doctor and or your midwife, and they can order the testing for you at that point. If you are exposed to a family member or have a close contact with someone who has been positive, that also may be an indication for testing. And that should usually be done about 7 days after the close contact while you're quarantining. Right now, we're testing women before they come in for their scheduled deliveries or cesarean sections. That's because we want to make sure that we know who is and who is not positive during the process of their labor, because at the time when someone starts pushing, because there's a lot of exertion, it can cause some we're concerned that it might cause some aerosolization of the virus. Although that's not something that we think routinely happens, we think that we want to be careful and keep mom and partner and the healthcare providers safe. So you might be asked to be tested about 3 days before you come in for a scheduled procedure, so that we know how to make sure that we take good care of you, your baby, and the people that are trying to take care of you in our hospital.
Right, we want to protect everybody, especially those who have to be there for the procedure. What happens when an expecting mother finds out that she has COVID-19? Do you have a protocol, or what happens after she gets that positive test result?
Absolutely. So it depends on the kind of symptoms that a patient might be having. If she has very mild symptoms, not too short of breath, has other symptoms that don't indicate a severe problem, she can be monitored safely at home. Usually her midwife or doctor will be in touch with her every couple of days to ask her how she's doing, and she should monitor for worsening symptoms, especially shortness of breath. If she has any of those, she should call and actually come into the emergency room to be evaluated. Patients who don't have symptoms really should be just fine. You should be monitoring to make sure that the baby's moving normally during the time that you're positive. And as long as the baby's moving well, we don't anticipate any problems. If you're positive at the time of your delivery, then we'll take special precautions during your delivery and after delivery to keep you, your partner, and the baby safe.
Now, if an expecting mother is put on a blood thinner, what can she expect from that?
So it turns out that the inflammation that happens when you have a viral infection can promote the formation of blood clots. We've actually seen blood clots that forming in patients who have moderate or severe disease in the non-pregnant population. Because pregnancy itself is a time when there's a higher propensity to form a blood clot, we think that even mild disease in pregnancy may put women at increased risk of having a blood clot. So we're following guidelines that have been set out by many of the countries around the world to treat women with a blood thinner. That blood thinner is usually an injection that you take once or twice a day for a period of 2 weeks. It shouldn't cause any symptoms, and hopefully, and we're hoping that injection will not only help prevent blood clots, but also help with blood flow to the placenta and optimize the placental function. So people who are taking those shots, I don't anticipate having anything more than the discomfort of taking the shot, but we're being very conservative and careful in making sure that we don't have complications that might be worse.
Now, are there any studies or research in place? I know we're still early in the pandemic, but any research or information that we know for children born to mothers who have had COVID?
Yes, absolutely. So the early research doesn't show that there's an increased risk of the virus actually reaching the baby during the pregnancy. So while the baby's still in the womb, we don't anticipate there would be a transmission from the mother to the baby. But after the baby delivers, we've seen women who have passed the virus to their babies. Most babies tend to have a mild course, although there is a more severe kind of pediatric specific version of the infection that sometimes requires hospitalization. We don't have information about long-term effects of the virus, but at this point, since babies don't appear to be infected while they're in the womb, we don't anticipate long-term problems. So we're still gathering that information, but I think expectant mothers should be comfortable that we don't anticipate problems. There's no evidence that this causes birth defect or any congenital abnormalities either.
All right, Dr. Esplin, we have about 30 seconds left. I'd like to get some final thoughts from you. What recommendations can you give us, maybe for expecting mothers who are watching right now? Any advice or tips that you would have for them?
Absolutely. The most important thing is to keep yourself safe. Wear a mask. Masks work. Wear a mask. Wash your hands. Keep social distance. Don't try to avoid exposure. And more importantly, if you are exposed or you develop COVID, it's going to be okay. I think what Brittany said is perfect. Work together with your healthcare providers to you can have a safe delivery and things will be okay.
Such a fascinating and insightful conversation. You've been hearing from Dr. Sean Esplin, Medical Director for Obstetrics for Intermountain Healthcare. Thank you so much for taking the time to join us tonight.
Thanks for having me.